Hey everybody, it's Dr. Galvin with today's coronavirus update. Today is Thursday, March 26th. First, the numbers, as we always do. It looks like 500 and, oh, look at this. It was 521, but it's refreshed since then. 523,000 cases worldwide, 23,500 deaths. U.S. has about 79,000 cases, 1,100 deaths. This is the Johns Hopkins virus tracker. And if you notice here, 80,021 cases in the U.S., 80,589 in Italy, 81,782 in China. So by tomorrow, the U.S. will be the place that has the most infections in the world. Our U.S. death rate is still is going up a little bit. It's going up at, slowly. It's at 1.5% now. Right now in New York, there's 38,000 cases, and I think they've gotten 855 deaths. Situation in New York is really getting desperate. I've been in contact with colleagues that I did residency with and friends who are just telling me horror stories. It's also starting to get very bad in New Orleans, and they think it may have been because Mardi Gras happened just prior to a lot of the restrictions going down, and that may be a next area of very severe outbreak. And I'm also hearing scary things from California. In our own hospital, we're seeing more and more sicker patients. You know, what are the symptoms of COVID? I keep getting asked this. Well, you know, part of the problem with this virus is that from anywhere from 2 to 11 days after you get exposed. So if I get exposed to somebody today, from 2 to 11 days, with an average of about 5 days, I'm going to show no symptoms. The virus is going to be replicating. I'm going to be able to give the virus to other people. And then, you know, I won't really develop symptoms or even have an idea that I'm sick until at least, 5 days to a week or maybe even longer. Then I'm going to get a fever. I'm going to get a dry cough. I'm going to have some body aches, a headache. I might get some nausea, diarrhea. People are reporting loss of sense of smell. And that is, other than the loss of sense of smell, is like so many other viruses. So people that keep telling me that I had these symptoms in December, it wasn't this, it was something else. But these are very, very common symptoms. The people who are advancing to more severe disease are developing those symptoms, and then about 5 days later, they're developing shortness of breath. And in about 10 days after that, or 10 days total after symptoms begin, they're getting markedly sick. Right now, it looks like about 81% of people are just developing the mild symptoms and recovering fine. About 14% of patients are ending up in the hospital requiring supplemental oxygen or something like that, and about 5% of those patients are critical. The scary thing is that I've heard some reports from colleagues that the mortality rate for the folks that are intubated with this is close to 80%. Now that's just hearsay that's being told for me by other physicians. I haven't seen any published numbers, but that may or may not be true, but I fear that it might be true. This is why we have to do this social distancing. I know we're killing the economy. I get it. I get questions and comments every day about this. What's worse, killing the economy or this? Well, I think that if we don't do these things, the scale of disaster is going to be unimaginable. And understand that, once the hospital is overwhelmed, it means we can't take care of heart attacks, we can't take care of strokes, we can't take care of motor vehicle accidents and gunshot wounds and all that stuff. There's no capacity. We've already had discussions in our hospital about the cath lab. If you come in having a heart attack, what's the standard of care? You go directly to the cath lab. Well, now they're talking about dusting off the clot busting drugs we used to use when I was a resident, many moons ago, because we're afraid to take these people to the cath lab and expose other people. So we have to be incredibly cautious, and that's why these restrictions are so important. And you got to stay home. You've got to isolate yourself. I keep talking to my family about the circle of trust. You can't break this circle of trust, meaning that the people that you're with, that you've been with for a while now, quarantined, are safe. Anybody outside, you don't know. They may not have symptoms, and they can still give you the virus. I'm going to try to answer more questions. People are leaving questions, and I'm trying to respond to them either directly on Facebook or if they're bigger questions, I'll respond to them here. I've had a few questions about, who exactly is at increased risk. We've talked about this, many times, but we know that people that have cardiovascular disease are particularly high risk. People that have chronic lung disease, so, whether it's really severe asthma requiring chronic steroids, emphysema or COPD, pulmonary fibrosis, or some other kind of primary pulmonary problem. Anybody who's immunocompromised that may have an autoimmune disease that they're being maintained on some kind of immunologic or steroid, anybody that's actively undergoing chemotherapy, all these things are things that can potentially make you at higher risk. If you've just had a surgery or you've just come off a big illness, your immunity can be compromised. So isolate, wash your hands, do all the things we've been talking about. What am I doing to protect my family? And someone's asked me, what do I do when I get out of work? And so this is my personal plan, and this is what I started doing this weekend. We have a little emergency doctor's office in the back with a shower, and so I'm bringing a change of clothes, I'm taking off everything, I'm showering at the department, I'm leaving my shoes there, so I'm bringing in a new pair of shoes, new everything, putting everything in a patient belonging bag, sealing it up, and then going home, dumping that stuff directly into the washing machine and running it, and then showering again, and washing those other clothes. And that's what I'm personally doing. The personal protection issue is really big. We don't have enough supplies. People have been incredibly generous in terms of donations and making things. I've got a dear friend of mine from high school who's making us masks. I mean, thank you, Marnie, you are awesome. Any little bit helps. Again, I'm glad to take those things and I'll get them to the hospital, but you don't need to bring them to me. Get them to EMS, get them to your hospital, the police, whoever. If you have masks, if you have any personal protective equipment that you're willing to donate. I had to go to the store and I saw all these people wearing masks in the supermarket. It's not going to help you. That's not how you're going to get exposed. It's not airborne, and those masks are not helping anybody. The people that need masks are people that are going to get coughed on and are going to be exposed to this virus close up. Someone asked me, how do you treat groceries if they're delivered to your house? We've heard these things where the virus can live for any number of days on cardboard and on plastic and things like that. I don't think it's a big risk, honestly. Those are laboratory conditions, so in perfect conditions, these things can live for that long. When you get out in the real world, it probably isn't a huge thing. But if you want to spray that stuff down with some Lysol or just even a little bit of water mixed with some bleach, that'll take care of it. Clean your wash your vegetables and do all the stuff that you would normally do. Somebody had a really interesting question about joint custody. If you're splitting custody of a child, what should you do? Well, you should do what's right for the child. And what's right for the child is pick somebody and have that person stay there. And if you can work it out, get together and stay there together, but having the child go back and forth is risky for both households. So that's my advice. Someone asked me about, I had the pneumococcal vaccine. Am I protected against COVID? Well, no, pneumococcus is a bacteria. Corona is a virus, and it gives you no protection. Someone also asked, I had the flu last week. Did the antibodies I made against the flu protect me? No. Remember, it's a novel virus. When I say novel, we've never seen it before, so none of us have any intrinsic immunity. Somebody else sent me a thing that said their friend had gone and gotten tested for 3 separate coronaviruses. They were all positive, and how many strains are there? Well, we think there are 2 strains, but that test your friend had was not for the corona. It wasn't for COVID-2, the one that causes COVID. There are coronaviruses that are in a panel called BioFire, maybe called other things, but there are about 3 common coronaviruses that cause respiratory symptoms, typically in kids, that we can screen for. Those are not the same thing. So if you're told that your coronavirus screen, and they did a huge screen called the BioFire, was negative, they did not test you for this particular virus. My regimen, I went over that. I think I've answered all the questions. As I keep telling everybody, if we follow these basic guidelines, if we keep ourselves safe, we're going to get through this. If we disregard it and we're out and about and we're exposing ourselves, it's going to be prolonged. How long is it going to last? I can't tell you. It looks like China locked down their population completely and we're able to get it under control in 6 weeks. Does that mean this is going to last for 6 weeks or 4 weeks? I can't tell you. I know people are hurting. I understand. I know people are out of work, but the alternative is a really massive toll on the entire country and potentially the entire world. Hang in there, just keep looking after yourselves, look after your families, look after those around you, wash your hands, and I'll be back tomorrow with another update. Have a great night.